OnTrack has been providing training and technical assistance since 1997, aimed at reducing health disparities to hundreds of organizations in order to meet the needs of increasingly diverse communities across a range of health and social service issues. Dr. Nolfo is a developmental psychologist and Robert Wood Johnson Foundation Fellow who integrates the latest research developments and community needs into strategies for youth and family wellness. Her expertise lies in developing culturally and linguistically appropriate programming and services, as well as training others how to maintain these key elements at the forefront of their planning and implementation efforts. And it is my pleasure now to bring to you Dr. Nolfo.
Thank you so much. Hello, everyone. It's really my sincere pleasure to be here with you today conducting this webinar. Appreciate that you took the time out of your day to learn about the class standards.
The HHS Office of Minority Health's National Standards for Culturally and Linguistically Appropriate Services in Health and Health Care, more commonly known as the National Class Standards, are intended to advance health equity, improve quality, and help eliminate healthcare disparities by providing a blueprint for implementing culturally and linguistically appropriate services. Why do we need culturally and linguistically appropriate services? For many, the way we think about and experience health and medicine in the United States has changed over the last few decades. The country is much more diverse, creating a wide spectrum of backgrounds, beliefs, and behaviors as they relate to health and healthcare services. People are seeking out new providers, which means providers are always seeing new patients. The way healthcare is provided is changing too. A team of professionals now work to care for individuals and families. A wide range of professionals and organizations, both inside and outside the exam room, influence our health and healthcare every day. All members of the health and healthcare community can benefit from the framework offered by the Enhanced National Class Standards. The National Class Standards outline the knowledge, tools, and policies necessary to provide culturally and linguistically appropriate services and care. Adoption of these standards will help advance the cause of better health and health care in the United States.
These class standards stand for Culturally and Linguistically Appropriate Services Standards. They're a set of best practices guidelines or blueprint healthcare organizations to provide class to diverse populations. It was first published in 2000. There were 14 standards, and then we got the Enhanced Class Standards, which were released in 2013, which are 15 standards. And all of this was issued under the Office of Minority Health, U.S. Department of Health and Human Services. So they're a set of guidelines, essentially, to help us do our work better. And these 15 enhanced national class standards come in this form of having one principal standard, and then these other categories of governance, leadership, and workforce, communication and language access, planning and accountability, and community engagement. So this is our principal standard: to provide effective, equitable, understandable, and respectful quality care and services that are responsive to diverse cultural health beliefs and practices, preferred languages, health literacy, and other communication needs. So this is overarching, that we're taking leadership, recognizing that this is something that we want to do, that we're committed to doing, and that it comes all the way from the top of our organization. And then within governance, leadership, and workforce, we have advance and sustain organizational governance and leadership that promotes class and health equity through policy, practices, and allocated resources. So everything that we're doing, that we're looking through this lens of how can we promote class and health equity? How are we examining what our policies are around, for example, who is it that we're bringing into this organization? Who is it that we're serving through this organization? What kind of leadership are we providing in the community? And how are we allocating our resources to align with those priorities that we have? It's not enough to just say that this is something that we value, but how does that look like from a budgetary perspective? Also within governance and workforce, recruit, promote, and support a culturally and linguistically diverse governance, leadership, and workforce that are responsive to the population in the service area. So this is where you actually know what the population is. Who are they? What are their needs? What is their history? What have been their challenges? What are their aspirations? So that you know what kind of a workforce you need to appropriately match to them. And this is where it's perfectly fine and really beneficial even to put out, when you're doing recruitment for new employees, to put that you're looking for people who have demonstrated knowledge of the communities to be served. That's perfectly legal to do. It should be a part of your job descriptions. It should be a part of your recruitment efforts, that you want people who actually have a demonstrated knowledge of these communities. Also within governance, leadership, and workforce, to educate and train governance, leadership, and workforce in culturally and linguistically appropriate policies and practice on an ongoing basis. So it isn't enough to just say, well, we have the workforce that we want, but actually that you're providing leadership in an ongoing way to ensure that people have the education and the tools that they need to be able to do their job effectively. And once again, this goes back to really assessing what is it that people need? Where is it that people are really having challenges? Are there places where they're stuck? Are there new and emerging populations that the workforce hasn't looked a lot of familiarity with? And so to provide the kind of training that is going to help the workforce to meet those challenges in an ongoing way. And to do evaluation of that training to make sure that you're actually getting out of it what you had hoped for. Within communication and language assistance, once again, these are, the class standards are to provide guidance to folks, but at the same time, they're really based on our federal non-discrimination laws. And so if you put yourself in a position where you're not providing the kind of language access that you need to within based on federal law, you're putting yourself in a fairly precarious position. So, that's one of the motivating reasons for people to kind of understand what are these class standards and what does it mean to align ourselves with the class standards. So there are these 4 standards within class that speak specifically to communication and language assistance. So you need to offer language assistance to individuals who have limited English proficiency and or other communication needs at no cost to them to facilitate timely access to all healthcare and services. And that people need to know that that is available to them. So inform all individuals of availability of language assistance services clearly and in their preferred language, verbally and in writing. And some organizations do this by having I speak cards, for example, so that folks can indicate what language it is that they speak. But people really need to know that this is a right that they have, that they can be offered these services in their primary language. And to ensure the competence of individuals providing language assistance, recognizing that the use of untrained individuals and or minors as interpreters should be avoided. So it's not that people cannot use family members as interpreters, but they should be really cautioned against, or they should be really informed on what some of the drawbacks are of using family members or friends to do interpretation for them. Obviously, there could be a gap around medical terminology. There also are issues of confidentiality that you cannot you can't ensure confidentiality if there's someone who hasn't been trained and entrusted in confidentiality in that setting. And so these issues need to be brought up to the patient or the consumer so that they can make an informed choice in using, for example, a family member or a friend in doing the interpretation. And of course, there are many examples of people using children, which is completely inappropriate and needs to be avoided. And to provide easy to understand print and multimedia materials and signage in the languages commonly used by the populations in the service area. So if you're providing any kind of print or multimedia materials and signage in English, you should do so in Spanish as well. And in particular neighborhoods, you may find that you have other languages as well that don't meet that kind of level of being a threshold language, but where you have enough people within that neighborhood or who get their services at a particular clinic or whatnot, where additionally language assistance should be offered in their languages as well. And this also, the class standards, when you go into the more detail on them, which I hope that you will take the opportunity to read the blueprint that's being sent out to you, that, when we look at the kind of the level of proficiency around providing translation and interpretation services, particularly interpretation, that although language lines can be very easy to use, and so we can't discount them, we can't write them off, they're not considered the best use of the best way to serve people. And so the best way to serve people is actually to hire bilingual staff. I mean, that, if you're able to do that within your organization, if you build your strategy and your resources, if you have mentorship programs in your community, pipeline development programs that you're able to develop to get folks who are bilingual in a staff, that's what we want primarily, right? Because to be able to have that conversation with someone in your own language, one-on-one, is what's best. What we look at after that is actually have someone who's a professionally trained interpreter in the medical profession who can interpret in between the provider and the client or the consumer. And so that's what we would consider kind of the next step around proficiency in this area. And then the third step would be using language lines. And so if you need to use language lines, by all means use them, but they really should be more of a backup as opposed to your primary strategy for how you're providing language access services or language assistance. And this is there was a segment that was aired on Sacramento Capitol Public Radio just a week or so ago that really got at these issues.
It can be hard enough to understand everything doctors tell you, even when they speak your language. For limited or non-English speakers, language can be a barrier to good care. Laws require translation or some accommodation for limited English speakers, but as Capitol Public Radio healthcare reporter Pauline Barloni found, people have uneven experiences communicating with healthcare providers.
Is it the right direction?
¿Está en la dirección correcta?
No.
Jaime Peña Urina gets cognitive and physical therapy at UC Davis Medical Center in Sacramento. He's still recovering from head trauma from a bike accident more than a month ago. With a Spanish translator in the room, his care becomes a team effort.
I'm going to work with you a lot on your balance.
Voy a trabajar mucho con usted con su equilibrio. ¿Está bien?
Estoy cansado.
I'm tired. Jaime's wife, Felicitas, says she's happy with the services and the medical translation at the hospital.
Las entiendo por medio de los traductores. Ellos vienen y explican lo que ellos necesitan.
They come and explain what the doctors need to tell me.
Sí, es bastante bueno el servicio.
The service is really good.
Hospitals and health insurers are required under state law to make interpretation available. Federal and California law require limited English speakers to have meaningful access at doctors' offices. But the experience of Spanish speakers at health facilities in California is not uniform. At the Mexican consulate in Sacramento, Isabel Flores runs the Ventanilla de Salud, a program that refers about 100 people a month to regional health care.
Sometimes just to make the initial appointment can even be a challenge.
Flores says the clinics where she refers people have Spanish speakers, but when she checks back in with patients after a doctor's visit, it's hard to tell how much they've comprehended.
Partially it could be language barrier, and the other part could be medical terminology. I mean, we go to the doctor sometimes and we're like, what does that mean exactly? But we know how to ask those questions. Sometimes it could be they're intimidated, they don't know that they can ask these questions, or they forget and blank out on the spot.
20-year-old Maria Medina says sometimes people at clinics speak Spanish, sometimes they don't. She translates for her husband, and that can be uncomfortable.
There's certain things that a woman should not know about a man, so like it's really complicated trying to translate those stuff.
But her husband Ruben Solis says he doesn't mind.
We're a couple, so I'm not embarrassed because she's my wife. If it were another person, maybe I would be.
Blanca Valdez has been in the country for about a dozen years. She says she hasn't had any luck getting Spanish-speaking providers.
Sí, me gustaría, pero sé que estoy en un país donde el inglés es...
It would be great if the doctor spoke Spanish, but I know that in the United States, English is the language. So I can't say, oh, why don't they speak my language?
So Valdez sometimes has her kids translate for her. But she says the doctor may explain a lot, and her kids will only tell her 2 or 3 things. Using relatives to interpret, although not ideal, can sometimes help people get care more quickly. That's what Dr. David Hayes Bautista says. He's director of the Center for the Study of Latino Health and Culture at UCLA's School of Medicine.
An interpreter is better than none, but the best is language concordance.
Hayes Bautista says lack of resources can limit patient access. Sometimes a Spanish-speaking clinic worker may be pulled in to translate, but won't have medical training. Or a translator might be brought in by phone. Hayes Bautista says neither solution serves the patient well.
It increases the chance for medical error, for the patient not understanding things, for the physician or the provider not understanding things. It restricts the flow of information.
Hayes Bautista says the larger problem is a shortage of Latino physicians in California. He says some things can be done about that, training more Latino or Spanish-speaking medical students, or bringing in more Mexican and Latin American doctors. Pauline Bartolone, Capital Public Radio News.
So under engagement, continuous improvement and accountability to establish culturally and linguistically appropriate goals, policies, and management accountability, and infuse them throughout the organization's planning and operations. Right? Conduct ongoing assessments of the organization's class-related activities and integrate class-related measures into measurement and continuous quality improvement activities. So are you really holding your organization accountable to the class standards, and how are you making sure of that? What kind of measures do you have in place that you're holding yourselves accountable to and checking in regularly on? To collect and maintain accurate and reliable demographic data to monitor and evaluate the impact of class on health equity and outcomes, and to inform service delivery. And so once again, this is, are you utilizing surveys, for example, to make sure that people are letting you know about their level of confidence in the service delivery that they're getting, and whether or not they are feeling comfortable with that service delivery? Are there areas in which you could be improved in that? Also, are you getting the demographic data that you need to actually know who you're serving and who you should be serving based on who's in your service area? We're going to go through the poll, actually. Okay, and so to conduct regular assessments of community health assets and needs, and use the results to plan and implement services that respond to the cultural and linguistic diversity of populations in the service area, so that the assets are and what the needs are within your service area, and are you using that information to plan appropriately in terms of what kinds of services you're offering, who you're hiring, all of those kinds of things. Are you partnering with the community to design, implement, and evaluate policies, practices, and services to ensure cultural and linguistic appropriateness? So what kind of partners do you have, and how do you engage the partners? Are they really engaged in your planning activities? Do you sit down with them with the data that you have to help them, to have them help you analyze that data and make decisions about how you're going to utilize that data and improve your practices? Create conflict and grievance resolution processes that are culturally and linguistically appropriate to identify, prevent, and resolve conflicts or complaints. So not to make the assumption that you're not getting any kind of grievance, that people are happy with the services, but in fact sometimes that can mean that people either don't understand what the grievance policy is, or that they are intimidated to bring forth a grievance. So to really examine what those conflict and grievance resolution processes are, and to make sure that people know them and are utilizing them. Communicate the organization's progress in implementing and sustaining class to all stakeholders, constituents, and the general public. So as you are having successes, with underserved populations, to make sure that you are letting the community know what it is that you're doing to achieve those successes, because that's a way that you may be able to essentially add to the field, add to the fidelity, or add to the utility in the field, so that other folks may pick up those practices that you're doing as well. If you are finding yourself challenged in certain areas, then it's also important that you let the community know that you're challenged in certain areas, because they may be able to help. And so just to be as transparent as possible in how it is that you are moving down this kind of journey or this road along aligning yourselves with the class standards. And here are some of the elements that you would want to have in any kind of cultural competence plan that you're putting together. And I've just added a couple of resources for you. There's a video that you might want to show and have a dialogue with in your organization that really looks actually at how law enforcement has put cultural competency really to the task within their own community. And there's also The Danger of a Single Story. This is a TED Talk that is fairly powerful. It's about 20 minutes long, and it's good to watch as a group and have some discussion about. This is the site thinkculturalhealth.hhs.gov, where you can find every resource you could possibly imagine about the class standards. You may have to register as a user, but have access to everything that's there. There are all kinds of research articles, all kinds of videos, so it is a treasure trove.
So thank you again for taking the time to learn about the class standards and cultural competence. We hope that it will benefit you in your work in your community. Thank you again for choosing OnTrack. Have a great day.